Reclaiming your sexual health after prostate cancer. Welcome to today's explainer. Pull up a chair and let's have a direct, no-nonsense conversation. Consider this your bedside consultation. Look, there are over 3 million men in the US alone who are prostate cancer survivors, and a vast majority struggle with what comes next. If you're tuning into this, you or someone you care about has likely been hit with a diagnosis. It's a hugely multifaceted problem, and frankly, a situation that leaves a lot of guys really unhappy and frustrated with the aftermath. We're going to look at how to deal with prostate cancer recovery, specifically focusing on your sexual health. There's zero sugarcoating here, no childlike analogies. We are talking man-to-man about real issues that affect real men. We're going to break down the clinical realities, the medical options, and the emotional roadmap you need to reclaim your life.
So how do you reclaim your sexual health after prostate cancer? It's the massive, burning question in the room. In my years of practice, looking at how my own patients have dealt with this, the most heartbreaking thing I see actually isn't the cancer itself, it's men suffering in total silence afterward. The reality is, surviving the cancer, that's only step one. Step two is actually living. And a massive part of a man's quality of life is his sexual health. Far too often, men feel ashamed or completely emasculated by the side effects of their treatment. But listen to me. Getting your sexual function back is not some luxury, it's a core, fundamental part of your recovery. Today, we're laying out a fiercely practical, clinical roadmap to get you right back on track.
Okay, the prostate cancer train affects all men, but reclaiming life beyond it is your right. Let's dive into this. This concept from the book My Prostate Cancer Train by Anthony J. Pisciferato perfectly represents the absolute freight train of a diagnosis that hits men from every single walk of life. Prostate cancer doesn't discriminate. It hits straight men, LGBTQ+ men, men of all colors and backgrounds. The medical system can be a really daunting machine to survive, but reclaiming your life beyond the cancer? That is your absolute right. This is about real men tackling a brutal disease head-on and demanding their physical and emotional intimacy back.
Have you tried anything yet? Viagra, vacuum pumps, injections? Imagine you're sitting in my clinic right now, and I'm looking over your intake form. I need to know your history. Any issues with sexual function? When did you first notice problems with erections? What have you tried? Maybe you've tried non-invasive oral medications like Viagra, Levitra, or Cialis. Have you tried a vacuum pump, a constriction band, or even penile injections? We've got to put absolutely everything on the table because treating erectile dysfunction after prostate surgery requires a highly tailored, step-by-step approach. I need to know what worked, what totally failed, and if you had any side effects like headaches, facial flushing, or penile pain. Establishing this baseline is absolutely crucial.
Sexuality After Cancer as an Unmet Need, Addressing Disparities, Achieving Equality. This is a quote from Dr. Ann Katz in the ASCO educational book, and it brilliantly illustrates a hard truth the medical community is finally waking up to. For way too long, the sole focus has just been on eradicating the tumor, right? Leaving the patient to figure out the devastating sexual fallout totally on their own. Dr. Katz's research points out that addressing this unmet need is critical. Like I said earlier, it's not just an extra perk of recovery. It's a vital component of holistic healthcare that every single man deserves.
Overcoming disparities in cancer care for LGBTQ+ men and men of color. Dr. Katz's work focuses heavily on this. The reality is that the burden of cancer, and frankly the lack of post-treatment support, often disproportionately impact LGBTQ+ men and men of color. In a clinical setting, we have to acknowledge that overcoming these healthcare disparities is paramount. Sexual recovery is a universal right. Navigating the healthcare system is already a giant puzzle, but it becomes even harder when you don't feel seen or heard by your providers. We absolutely must ensure that comprehensive, culturally competent sexual health rehabilitation is accessible to every man fighting this battle.
The use it or lose it principle of penile rehabilitation. So, the crucial point here is understanding the clinical mechanics of recovery. According to expert urologists like men's health specialist Dr. Amy Perlman, erectile dysfunction after a radical prostatectomy is almost always due to nerve damage. Even in nerve-sparing surgeries, the nerves get bruised and traumatized. It can actually take up to 2 years for those nerves to wake back up. And here's the kicker. Within just weeks of inactivity, that lack of oxygenation causes the tissue to lose flexibility and form scar tissue or fibrosis. That's why early intervention is literally a use it or lose it scenario if you want to preserve your length and girth.
So how do we stop that? Here is Dr. Perlman's vacuum rehab protocol. Step 1. Start 1 month post-op. Step 2. Inflate for 5 minutes. Step 3. Release suction briefly. Step 4. Inflate again for 5 minutes and absolutely no tension band. I want to be clear here. This isn't a toy.
It's a medical rehabilitation tool. You're doing this daily, drawing blood into the penis. Notice that key detail. For this first month of rehab, you do not use the tension band. The goal right now isn't sex. The goal is simply stretching the tissue, flooding it with oxygenated blood, and stopping that scar tissue dead in its tracks.
Comparing ED treatments, non-invasive oral pills versus penile injections. When we evaluate your options for actually having intercourse, we really have to weigh convenience against effectiveness. On one hand, you have non-invasive oral pills, stuff like generic sildenafil or tadalafil. They're cheap, easy to take, and a great first-line therapy. But here is the clinical truth, man to man. Pills rely on those damaged nerves to work. After a prostate removal, they often just aren't enough. On the other hand, we have penile injections, like Trimix. Yes, you are injecting the side of the penis with a tiny needle, which I know sounds intimidating, but it is vastly more effective post-surgery because it bypasses the nerves entirely and directly opens up those blood vessels.
Comparing long-term options, oral medications versus surgical penile implants. If pills aren't cutting it and injections just aren't for you, we look at the ultimate long-term solution. Let's juxtapose those on-demand pills with a surgical penile implant. An implant is a completely concealed device placed entirely inside the body. You squeeze a small pump in the scrotum to get an erection and press a button to deflate it. Why do men choose this? Because it offers rock-solid, reliable, spontaneous erections. For a man who wants permanent, reliable spontaneity back in his life without needing to plan his intimacy around a pill schedule, a surgical implant is often the most definitive, satisfying route. It doesn't affect sensation, doesn't affect climax, and it puts you 100% back in control.
Sexuality counseling. Professional, resolution-focused guidance to address sexual challenges, improve partner communication, and redefine intimacy after illness. Listen, you can fix the physical plumbing all day long, but if you don't address the mind and the relationship, the healing is completely unfinished. This is where sexuality counseling comes in. Dr. Ann Katz operates a practice focusing exactly on this. She uses a brief, resolution-focused approach. Actually, scratch the idea of traditional therapy. You aren't lying on a couch for years here. It's practical guidance to clear the psychological hurdles, dramatically improve communication with your partner, and fundamentally redefine what intimacy looks like for you after surviving cancer.
Reclaiming intimacy with your partner requires honest communication, exploring non-medical options together, and redefining what sex means post-cancer. Reclaiming that intimacy at home is a team effort, guys. There are absolute non-negotiables for you and your partner. First, honest communication. You cannot hide your anxieties or your physical struggles from your partner. Second, you got to explore non-medical options together. Intimacy isn't just about an erection, it's about emotional closeness, touch, and connection. You have to redefine what sex means post-cancer. It might look different than it did before the diagnosis, and you know what? That is completely okay. The goal is a fulfilling, joyful connection. That requires taking off the armor, being vulnerable, and being unashamedly honest with your healthcare team about what is and isn't working.
What is your next step to reclaim your intimacy and life beyond cancer? We've covered the medical mechanics, the rehab protocols, and the emotional groundwork. The tools are absolutely out there, from pills and pumps to implants and counseling. You do not have to accept the loss of your sexual health as the permanent, unavoidable price of surviving prostate cancer. No way. So I leave you with this final, critical question to chew on. Will you let the disease dictate your intimacy, or will you take the next step to reclaim your life? It all starts with a single conversation. Pick up the phone, talk to a specialized urologist, talk to your partner, and take that first real step toward getting your life back.